Okay, good morning. Today we're going to talk about the COVID-19 issue and how it affects the city of Lethbridge. Our number one priority will always be to protect the health and safety of our residents and employees. We have activated our Emergency Coordination Center, or ECC, and are meeting daily to monitor this fluid situation in our city. So we had city staff working all weekend. Our city leadership team is meeting regularly to discuss the COVID-19 situation and proactively plan contingencies for essential city services, should there be any interruptions in available staff or resources. To date, there has not been a case identified positively in Lethbridge or in the South Zone, but we will continue to receive information from Alberta Health Services and the Medical Officer of Health. As of last night, we've made the decision to close all city recreation facilities and other facilities. These closures are in place until further notice as a precautionary measure and to best minimize the risk to our community. As the COVID-19 situation evolves and changes, the city will continue to be diligent in monitoring and in following the recommendations of our local health authorities, that's Alberta Health Services and the Medical Officer of Health, and the World Health Organization.
Are there any chances that if things continue to escalate that the city might put a state of local emergency into effect?
That's entirely possible. We'll be continuing to monitor the situation locally and considering further actions that are in the best interest of the community and our citizens.
I know there's been lots of pages popping up on social media about people helping one another. As the mayor of Lethbridge, what's your response to that, seeing people?
I think that's exactly the response we need. We need people to help one another. There are people who are not in peak physical conditions. There are people who need supports in our community. People who have immune deficiencies, who really are terrified at the moment that this virus might come to our city. So we need to make sure that we can assure and support those people in our community.
How is the emergency department preparing for something like this, especially for EMS who are going to be going and helping sick people?
Yes, so we've already been transporting folks under sort of the new guidelines that Alberta Health Services has set out for us. So we take all of our direction for the ambulance piece through AHS, and then we obviously just make sure it works for all of our staff here. So we've set out a very stringent guidelines with AHS, and we're monitoring all the situations and all of the sort of touch points our staff have with people who possibly have the flu or any other sort of pathogen. We've been dealing with this type of piece our entire career. Right, so this isn't something new for our staff. We deal with people who have contagious viruses and other medical issues. This is a normal part of our business. We've just sort of amped up some of the pieces in terms of cleaning and making sure that we've got all of it locked down. So nothing new for our staff, just a couple of new policies in place.
Have you seen any change in the volumes of calls you're getting and that sort of thing?
Yes, so we are seeing some more people that are and it's possibly they're not following the 811 piece and following the guidelines Alberta Health Services has set out, but we are seeing a few more flu type calls that folks are wanting to be transported to the hospital. And so again, we're taking all precautions at this time. We know that we don't have a confirmed case down here, but that's not how we work. We work on making sure that we take all precautions at all times with all patients.
I know there is measures that can be taken if a local state of emergency is issued when it does come to some of those mass buying and purchasing. What kind of role would that play for you?
So we do have some powers when we enact a state of local emergency. Most of them are around making sure we don't have price gouging and things like that. But when it comes to the hoarding piece, again, we don't have control over folks that way. So we want to make sure people are monitoring themselves and making some really good choices out there in terms of this is something that's going to go on for quite a bit of time. So we want to make sure that we just work like you normally do. Make sure you have your 72-hour kit available for you and some supplies at home.
Now, how does quarantine work for emergency responders? Because I'm sure you guys want to make sure that you have enough responders in case there is a spike in cases here.
Yeah, so self-isolation applies to our staff. So our staff are taking all the basic personal protective equipment precautions before they go into a call and where there might be an exposure. So our exposures are lower, considerably lower, because we're taking all precautions. In the rare case that we might have a significant exposure, those folks will be self-isolating as well. And we'll also have our medical directors involved with that in terms of how we're going to monitor and test them. That sort of thing.
So yeah, last night we sent an email out to staff letting them know that, well, obviously they were paying attention to the news release about the school closures, that if they had childcare issues, they were to stay home for today, as well as if they were ill. We're continuing to gather that information right now, asking business units to provide us that information, so we've got that for a meeting later today.
Are meetings are going ahead? Will council be sitting? Is the community issue meeting moving ahead as usual, or are you going to take any precautions if they are?
Again, that's a call for council to make with respect to their continued meetings, and so they'd have to make that decision themselves.
But it hasn't been made yet.
It has not been made. There's still a council meeting, business as usual, yes.
You have your kiosks here at the city. You have city employees out there that are doing essential services. Are you guys thinking about the next step of this and how you're going to protect those employees from?
Yeah, we've had some discussions around, and I think we've been encouraging people to go online if you can do business with the city online, obviously for City Hall. But again, it's business as usual for our staff, and we are ensuring that there's. Our goal is to ensure we have those critical services that the residents always expect to receive, but we may be having to redeploy staff in a different way depending on how deep this goes in terms of our capacity.
So like the kiosks here, for example, maybe paying bills online instead of coming in.
I would encourage everyone to do that. As we're trying to encourage the community to do social distancing, that would include coming to City Hall if you don't need to come here.
And we have some big expenses like property taxes and whatnot coming up. Is there a fear that this could impact that? Maybe having to give people extensions or something like that?
We haven't had that conversation, although that is something that City Council would have to make a decision on. Today, everything is business as usual as it relates to that, but we may have to make some recommended changes.
Okay. Yeah.